Alright, hi Crystal.
Hi.
Welcome. I'm going to be doing a physical assessment on you today, okay?
Okay.
First, I want to start by taking your temperature here. Alright, if you lift up, put this under your tongue. Alright, 98.4, good. Now, I'm going to check your pulse. Alright, your pulse rate. Just relax. Alright, 66. Alright. Got a pulse rate of 66 and 16 respirations. Alright. Now I'm going to go ahead and get your blood pressure here. And do you know your normal blood pressure rate?
It's been a little high, so probably was 128 over 90.
120 out. Alright. Go ahead and check that today. Just relax your arm. Alright. So a little higher today. We have 135 over 78. Alright. Good. Alright. Now we're going to go ahead and start with the physical assessment. I'm going to be assessing your skin for color, temperature, vascularity, and skin turner, alright? Go ahead and touch the temperature of your skin. Make sure you're not too cold or too warm. Your mind for your hands where you go. Alright. Now do skin turner. You have good skin turner. Alright, vascularity, everything is fine. Now I'm going to go ahead and inspect your nails to make sure for capillary refill. Less than 3 seconds. Good, good. Now if you do your hands like this, you want to perform what is called the Shamrock test. And what that is, it shows the angle of your nails. If it's less than 160, then it's good. There's no signs of clubbing, which means there's no respiratory problems. You can put your hands down. All right, now I'm going to go ahead and inspect your hair. I'm looking for hair distribution, evenly distributed, any excess or absence of hair, the lustrous of the hair, luster of the hair is shiny, everything looks good. Now I'm going to inspect the scalp. Sorry, I'm a little short. Inspect the scalp here to make sure that there's no bumps or lesions in the hair. Now I'm going to palpate the scalp for any bumps or lesions. Alright. There are none, everything is good. Alright. Now we're going to move down to your face. I'm going to assess your face, make sure everything is equal. There's no skin discoloration or anything. Alright, everything looks good. Now I'm going to palpate your face to make sure there's no bumps or anything. And I'm going to palpate your frontal sinuses. All right. I'm going to palpate your maxillary sinuses. Do you have any pain in any of those? Good. So that means that there's no sinus infection going on here. Now I'm going to assess your ears. First, before I do that, I'm sorry, I'm going to assess your neck. Let's start there. Going to assess your neck, make sure everything looks good. I'm going to ask you here to take a sip of water. All right, hold your head back, and I'm going to look at your trachea. Good. It moves up and down normal. Now I'm going to palpate your trachea. All right, it's in a nice position. Nothing's out of place. Now I'm going to palpate your thyroid. All right, that looks good. Now, if you have now I am going to palpate your lymph nodes. All right. So first we're going to start with the post-auricular, the pre-auricular, the occipital, then the retropharyngeal, the submandibular or submaxillary, the submental. Then if you turn to this side, I'm going to palpate the for the deep carotid artery. I mean the deep um, cervical chain. I'm sorry, on here. Then the post cervical chain, and then the superficial cervical chain. Now do the other side. Turn. Palpate deep post cervical chain, and then the superficial cervical chain. Then I'm going to palpate for the supra clavicle, and then the inferior clavicle chain. All right. Now I'm going to palpate your carotid arteries. I'm sorry, your temporal, yes, your temporal and your carotid artery. All right, you turn. Now do your carotid artery, one at a time, next. All right, that looks good. Now I'm going to listen to your carotid artery with the bell of the stethoscope. All right. All right. I hear nothing, so that's good. There's no bruise going on. Now I'm going to inspect your ears. All right. You turn, I'm going to use the otoscope, and I'm going to pull up and back. All right. It's a tympanic membrane. It's pearly gray, which is good. Pull up and back. Same on this side, flat, pearly gray tympanic membrane. Right, now I'm going to ask you to stand up so that I can perform the rumbar test, which is checking for cranial nerve number 8, the vestibular. All right, so if you put your hands to the side, close your eyes, and lift up one foot. Arms out. Let's try that. Close your eyes. All right. All right. Other side. Okay. There you go. A little wobbly there. A little wobbly. All right. Then, okay. Now I think that we get the ears. Palpate the ears. I'm sorry, for the orca and the tergus to make sure that there's no lumps or lesions on her ear. All right, now I'm going to also perform what's called the Wimber and Renee test. And what that does is it tests is for air conduction. And the Wimber test is for, I'm sorry, bone conduction. All right. I'm going to hit this, tune it forward, put it on top of your head, and then you let me know when you hear it in both ears, okay?
No.
Okay, good. Now I'm going to do the Renee test, which is for bone bone density and air conduction versus air conduction. Okay.
Okay.
Now I'm gonna put this to your ear, and you let me know when you stop hearing, when you stop feeling it vibrate, and also when you stop hearing it. Okay.
Okay. No. No.
All right. Good. Now, actually, I did that wrong. I should have did the bone conduction first. So I'm doing this.
No. No.
All right. You had 9 and 14. Good. I'm gonna do it right on this side. Okay.
Okay.
So I'm sorry.
No.
All right. All right. 9 and 16. Good. Now I'm going to assess your nose. Make sure that it is symmetric in the middle of your face. That is not to the left or the right. All right. And I'm going to palpate your nose. So make sure that there's no bones or anything out of place, no bumps. Then I'm going to look at your spectrum deviation and then any your turbinates in your nose. Okay. So if you hold your head back, good, good. All right. Now, also with the nose, we're going to go ahead and do a smell test. So before I do the smell test, I'm going to go ahead and test the patencies of your nose. So I'm going to close one nostril and ask you to breathe in through the other one, okay? Breathe in. All right, now we're going to do the other one. Breathe in. Good. Now, if you close your eyes, I'm going to have you smell two different items in each in your nostrils, and I want you to tell me if you can tell the smell, okay? All right. Breathe in.
Vanilla.
Good. All right. Breathe in.
Berry.
Good. Good. Good job. Now next, I am going to look at your lips. Give me one second. Forgot my gloves. Forgot my gloves. Next, I'm going to inspect your mouth. First, I'm going to assess your lips, make sure that they're moist, pink, no cracks or anything on your lips. All right. Then I'm going to palpate the lips to make sure that they're smooth. All right, everything's smooth there. Now I'm going to ask you to open up so I can look at the uvula um, of your mouth. If you say I.
Ah.
All right, that is testing cranial nerve number 10 as well, the vagus nerve. All right, I'm looking at the stensons mucosa, everything is good. You lift your tongue up. All right, the warden's ducts looks good. There's no lesions, nothing swollen under there. All right, now we will perform a gag test, which will also be testing vagus nerve 10. But and what you'll do is you'll stick this on her tongue and back a little bit, and she should gag. And if so, that's a good gag reflex. All right, smile. All right, her teeth are nice and white. They're straight gums. There's no lesions or bleeding or anything from her gums. All right, so now next we're going to perform a taste test. Okay, I'm going to give you 4 different items or 4 different parts of your tongue. And I want you to tell me what you taste. Close your eyes, okay? Say hi. Did you get it?
Cinnamon.
All
Berry.
right. Touch your tongue.
It's lemon juice.
All right. What is
Sour.
Sour. All right. Bitter and sour on the tongue. Test is for cranial nerve number 9, which is the glossopharyngeal. All right. Now I'm going to have 2 more for you. Sugar. All right. Which is
Sweet.
okay.
Salty.
Salty. All right. And sweet and salty test is cranial nerve number 7, which is also the facial nerve. Here's a sip of water. Also, I'm sorry, let me go back to the facial. Also testing for cranial nerve, I'm going to ask you to smile, frown, and puff your cheeks out. All right, good. Now I'm going to ask you to stick your tongue out and move it side to side. Good, good, good. Now, sticking the tongue out, moving it side to side is testing cranial nerve number 12, which is the hypoglossal. All right, then I'm going to ask you to actually um, push your tongue to the cheek. All right, other side. All right, that also tests cranial nerve number 12, the hypoglossal. Okay, now I'm going to ask you to shrug your shoulders. Good. Now that is testing cranial nerve number 11, which is the it's gonna come to me. A different accessory. I know it comes to me. All right. Now we are moving right along down to the eyes. Okay. We've already performed the Snellen chart test, which tests optic nerve number 2, and it tests for far vision. Now we're going to assess her eyes. They're equal. Equal bilaterally. Her eyebrows are equal. All right, and we're just gonna look and make sure everything is nice and symmetrical. Good, good. Now we are going to perform a couple of tests, which will test your cranial nerve 3, which is oculomotor, 4, trochleocular, and then 6, your adducens, okay?
Okay.
But now I'm going to look in your eyes. Just look straight ahead. All right. Now that was looking at her eyes. Her pupils are reactive. Um, are equal and reactive to lights. All right. All right. Now we are going to do what is called a conceal and constrict test. And what it is, I will put my hand and shine the light into one eye, and your pupils should constrict in the opposite eye that the light is not shining in as well. Okay. Good. 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 Now we are going to do what is called the cover and uncover test, and this test is for lazy eye. So I'm going to put this here. All right, just go straight ahead. All right. I'm gonna do this side. Straight ahead. Good. If she had lazy eye, then the eye that was covered, when it was uncovered, it would deviate out. Okay. Now I'm going to perform the H test. So you just look straight ahead, follow this pin, all right, with your eyes, not your head or anything else, okay? All right. Don't worry, the H is a little checked up. Good. Her eyes follow the H test, which again is checking cranial nerve 3, 4, and 6. Okay. Now, now I'm going to shine the light on the bridge of your nose, and there should be a twinkle in the middle, in the corner of your eyes. Okay. Good. 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 Now we're going to do the visual field. All right. So if you stand up, and she's a little taller than me, so it's okay. She's a little taller than me here. Okay. All right. So with your cover this eye. Yeah. Okay. So backwards today. Cover this eye. And with this eye, when you see my hand coming into your vision, just let me know, okay?
Okay. Now, now, now.
All right. Now, do the same thing.
Now, now, now.
Good. Now cover the other eye. We're gonna do it again.
Now, now, now.
Again.
Now, now, now.
Good. Thank you.
You're welcome.
Now that again was testing cranial nerve 3, 4, and 6 with the visual field. All right. Now I'm going to have you read something, which is you can sit down. I'm sorry. I'm going to have you read this line, which is the Rosenbaum test, and it tests ocular nerve number 2 in your near vision. So just read that first line for me.
Okay. We all want the best quality care for our patients, but without data to support your quality improvement efforts, how do you really know what the best possible care is?
Good, good, good. I think I mentioned before that Vision was 2020 on the center charts that we did earlier for far vision. All right, now we are going to go ahead and move right along to your thoracic cavity.
Okay.
All right. Well, let's stand up. I'm a little short. Okay. So we're going to make sure that you're just as wide, just as long as you are wide, which you are. Everything looks everything looks straight. It looks good. Now we are going to. You can turn around for me, please. Thank you. No, to the back. Thank you. Yeah. Now we are going to assess her lung sounds. Okay, and you can do a posterior and anterior and posterior, but we're going to do posterior today. But anterior, you have the thoracic, you have the brachial vestibular, and then everything under at the bottom here is her vestibular. You don't have the thorax on the back. You have the brachial vestibular, and then a vestibular. Okay. So first, move right halfway. I'm just going to palpate. All right. And we're going to do it bilaterally to make sure that there's no, so that we compare one side to the other. Okay. Now I'm going to palpate. All right. Now I'm going to listen to her lung sounds. Good. Everything sounds good with her lungs here. All right. Now I'm going to check the lung vibration. I'm going to have you say every time I touch you, I want you to say 99, okay?
Okay. 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
All right. Now I'm going to listen with my stethoscope, and I want you to say every time you touch me, I want you to say E, and this is testing. This is the egophony. All right.
E,
Say E.
E, 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 E.
All right, good. If it was any abnormalities with her lungs, when she said E, it would sound like A. All right. Uh, you can sit down now. Oh, I'm sorry. Back up, please. One time. Sorry.
It's okay.
Okay, you turn around. I'm going to turn around. Yes, thank you. I'm going to pinch the base of her lungs here, and I'm going to ask you to breathe in and breathe in deeply. And I'm just checking for the lung expansion. Okay, so take a deep breath. Good. The rising and fall of her lungs she has a good lung expansion. All right. Now we are off to your abdomen. Okay. Yeah. We're gonna do the heart first, actually. Okay. Sorry, we're gonna work our way on down. All right. So first, I'm going to examine her chest. My client has big boobs here. Bring this a little closer, side. All right. There we go. Good. Okay. So then I'm going to tape off her heart valves here. Okay. I'm going to tape off her heart valve starting at the second intercostal space, which is her aortic valve. All right. Which is on the right sternal border. Then I'm going to go over to the left sternal border when the second intercostal space, which is her pulmonic valve. Then I'm going to go right down here to her third intercostal space, which is Erb's point. And then we're going to estimate underneath all the boobs her fourth intercostal space here. So I want to fill all of my patient's chest. I'm going to put it on the outside of her shirt. And then at her fifth intercostal space, which is underneath here, so I have to lift up a little bit, which is underneath here at the mid-clavicular line, is her mitral valve. All right. Now we're going to listen to all of her valves with the stethoscope. Good. Now what we heard, she has no abnormalities. Her heart valves were good. S2 valves were louder at the aortic and the pulmonic, which is it should be. Erb's point, the valves were equal. S1 and S2 was equal, and S3 and 4, the pulmonic and mitral valves were S1 was louder. Now we're going to listen with the bell of our scopes to see if we hear any murmurs. Good. No murmurs were heard, which is what we like, and that's what we want. All right. So now we're going to move right on down to her abdomen area, and we're going to get an eye level to assess the rise and fall. So make sure his peristalsis going on there. All right, good. Now I'm going to go ahead and divide your abdomen up into 4 quadrants, starting at the umbilitus. All right, and then we have the right upper quadrant, the left upper quadrant, left lower quadrant, and then the right lower quadrant. And I'm going to listen to all 4 quadrants to see if we have active bowel sounds. Good. We have active bowel sounds in each one of the 4 quadrants. Now I'm going to palpate her abdomen. Good. Now I'm going to listen with the bell of my scope to her arteries. We're going to start with the aortic artery. Then we're going to go to the renal arteries here, the iliac, and then the femoral, but we're not going to do the femoral arteries today. Good. All right, we heard nothing, which is what we want. Now we're going to go ahead and palpate her liver and her spleen. All right. So what I'm gonna do is I'm gonna put my right hand under you, and then I'm going to palpate with my first I'm just going to palpate. I'm sorry, lightly palpate the whole abdomen. All right. Now I'm going to palpate your spleen, and what I want you to do is take a deep breath in. As you exhale, I'm going to press down. I'm sorry, not the spleen, the liver. All right. All right. Take a deep breath in. Let out. Good. We didn't feel the liver, which is what we want. Now I'm going to reach over and do the spleen. Do the same thing. Take a deep breath in. Let it out. Good. There's no enlargement of the spleen or liver, which is a good sign. Okay. Now we are going to move right along to your neurologic. All right. So you can sit up. All right. All right. Now we are going to test to make sure you're not crazy. Okay. Just ask you a few things. All right. We want to give you 3 words, and I want you to remember. I'm going to ask you them later. Okay.
Okay.
Horse, carriage, boy. Okay.
All right.
All right. Now I'll ask you a few questions. What is today?
Today is Monday.
All right. What time of day is it?
It's the morning
All right. And where are you?
for university.
All right. She's alert and oriented times 3. Now I'll ask you something from your present memory. What is your birthday?
July 25th, 85. I had to think about
Shit,
it.
think about that. We don't know. All right. Name one of your current teachers.
Dr. Outlaw.
Hey. All right. Good. Now we are going to what were the 3 words I gave you?
Horse, carriage, and boy.
Good. So her memory is good. Now I am going to Now I'm going to do sensory, which is still part of neurological. Okay. I'm going to, before that, I'm sorry, I'm going to ask you two things to see if you have sound judgment and abstract. Okay. If you found the wallet, what would you do?
I would turn it in.
Okay, good. And what does it mean to never judge a book by its cover?
You should never look on the outside first. Look on
Um,
the inside.
good, good, good. Now, what we're going to do is, for neurological as well, we're going to do a cotton whisper, which is a sensory test. And what that is when you feel it, I want you to tell me. And this checks for cranial nerve number 5, trigeminal. All right. Close your eye.
Now, 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 now.
Good. All right. And now we're going to do a dull and sharp test. Okay.
Okay.
So I want you to let me know if this is sharp.
Okay.
Okay. And that's dull.
Okay.
All right. So close your eyes and let me know.
Sharp,
Yeah.
dull, sharp, dull, dull. No, sharp. Sharp,
Okay.
sorry. Sharp, dull, sharp.
All right. Good. Now I'm also going to ask. I'm going to do 3 other tests. Okay.
Okay.
The one starting with graphio anesthesia. All right, and what that is I'm going to have you close your eyes, and I'm going to draw something in your hand, and I'm going to draw a letter, and I want you to tell me what it is. Okay?
Okay. M.
Yes.
Okay.
All right, now draw a number, and I want you to let me know what it is.
0.
All right.
Okay.
Now I'm going to put 2 objects in your hand, and I want you to identify them, and this is the stereogenosis. I'm saying that right?
Key.
Good.
Coin.
All right. Now the other one is I'm going to touch a body part, which is the kina, kinetic anesthesia. Okay, and I want you to tell me what body part I'm touching on. Okay, now close your eyes.
Arm. Chest. Forehead. Nose. Leg. Hand.
Good, good, good. All right. Now I am also going to when you came in, there was 3 tests, a 3 and 1 that we're going to do. We did the rumbar test already, which is one of them. That checked cranial nerve number 8, vestibular. Then I looked at your gait as you came in. Your walk was fine. You didn't stumble. You didn't have any balancing problems. Now I'm going to ask you to stand up.
Okay.
All right. I'm going to ask you to hop on 1 foot.
Okay.
All right. Good. All right, you can sit down. Now I'm going to do an upper one, and what I want you to do is touch your fingers like this, back and forth, and just go faster. All right, good. Now with your legs, your lower extremities. I hope that they see your hands. Oh, if you should do this one more time. I don't know if you saw the hands. Okay, good. Now I'm gonna go to your lower extremities, and I want you to make a figure 8. All right, other foot. Good, good, good. All right, now we are moving right along to our last part. Okay. Our last, and actually, let me go back, please, because I did forget with the abdomen. I need to check her liver border. So please lay back down. Thank God for my tape over here. Okay. Now, what I'm going to do is percuss her liver border. Okay? All right, here. And I'm going to percuss up, starting from her umbilitis and go out, and I'm going to tape it off for where the sound change is at, okay? Now I'm going to start up from her fourth intercostal space, and so you can't really see what I'm doing. There you go. Fourth intercostal space, and percuss down until I hear a sound change. Okay. We're gonna do the best we can underneath the boobs. All right. Now our liver border should measure between 6 to 12 centimeters or 2 to 4 inches. And we are going to measure inches here. Okay. All right. Our liver border is 3 inches long, which is good. All right. Now, if you sit back up, we're going to finish the musculoskeletal, which will be the last part of our assessment for the day. Okay. Now I'm going to assess your joints to make sure that everything is okay. All right. Let's see. Help and assess the joints. Good. Now I'm going to check her reflexes. We'll start with the brachial reflex. We'll let your hand go. I'm sorry, the tricep. Good. Do this part. Relax. Good. Now I'm going to do the brachial. Good. Just relax. All right. Good. Now I'm going to do the radialis. Right? You put your arm up there. Good. Do the other arm. Good. Now I'm going to do the patella. All right, she got my reflexes. But there you go. All right, good, good, good. Now I'm going to do some strength tests. I'm going to pull with your arms, and I want you to resist.
Okay.
All right, there you go. Now push. Good. Same with your legs. Push out. Good. Pull. Good, good, good. All right. Now, and it's one other thing that I just thought about that I forgot to do when it came to the heart was check your pulse on each side. Okay, so we're gonna go back and check her pulse. Okay, I'm gonna check her radius. All right. We do both sides. Good. Now I'm gonna do her brachial. Good. Good. And we did her carotid and temporal earlier. All right. Then we're going to do the posterior temporal, I'm sorry. All right. Now we're going to go down. Well, I guess I'll do the temporal again. Relax your leg. All right. Now I'm going to do the um, dorsalis pedis. All right. Then I want to do the. All right. So let's go back through because I feel like I missed something. But we're gonna go back through our cranial nerves. We did cranial nerve number one, which was the olfactory with the smell. Then we did cranial nerve number two, which was the optic with the Snellen chart and the Rosenbaum test. We did cranial nerve three, which is the ocular motor, with the visual field test. It tests your muscle movements, as well as cranial nerve number four, the trochlear motor, trochlear ocular, I'm sorry, which is with the field test, the H test, which also tests eye movement. Then we did trigeminal, which is cranial nerve number five with the sensory test. Then we did cranial nerve number six, which is the adducens as well. It checks the eye muscle strength and movement with the field test, the visual test. Then we did cranial nerve number seven, which is the facial test with frowns and smiles. Then we did cranial nerve number eight with the Rosenbaum Romberg test. I'm sorry, which is the vesticular vestibular vestibular test. There you go. Then we did the cranial nerve number nine, the glossopharyngeal with the bitter and sour taste buds on the tongue. We did the vagus nerve with the gag reflex is what we would have done with that. And then we did and the swallow test. And then we did the cranial nerve number 11, the accessory test with the shrugging of the shoulders. And then we did cranial nerve number 12 with the tongue going from tongue out, moving from side to side, and also the tongue pressing against the inner cheeks. All right. So I believe we went through everything, and I hope I covered everything. Yay!